So I've learned lots of skills. I think there's been the sort of formal training that we've had through Ashridge, through business school, which has been around things like leadership training, transformational change, resilience training, and so on. There's been tool sets that we've used, like action learning sets, again, which were new to me, and that sort of collaborative working, that's been fantastic. I've also learned a lot more about what Diabetes UK and Diabetes Scotland does, and the opportunity for working in partnership with them. But perhaps one of the biggest things has been around sort of the peer learning from other people in the group. I think having that real mix of people from around the UK and from different disciplines, the multidisciplinary team from around the UK, has been really invaluable in terms of understanding what's going on in different areas, what's working, what's not working, to hear about really interesting, innovative projects. And that peer learning has been absolutely fantastic for sort of fueling different areas of clinical care improvement.
In my project, looking at changing the way or evolving our model of care, it's really useful to see other models of care from across the UK. And one of the nice things about the Clinical Champions programme is that you meet people you may not otherwise meet. Usually you know all your peers in your locality, but you don't know people from across the country who can often bring very new perspectives or different models, so that's been incredibly useful. The teaching of the leadership skills, or the development of one's leadership skills, has been absolutely key to my development as a leader, and a key part of the programme for me, certainly. And the nice thing about being at Ashridge is that you're away from your usual environment, so you've got time to reflect and look at what you do, and then see about how you can develop that, bearing in mind the experience that one's had here. On top of the sort of generic leadership skills, at Ashridge we've also come across various tools that you can use in specific situations, particularly when you get stuck. And the other aspect where I've really learned a lot during the programme is in the action learning set. So that's when we get together with other champions and essentially discuss issues that we have. And I found that incredibly useful because often other people bring a different perspective and a fresh pair of eyes to one's problems. And often they've had a similar sort of problem, and you can learn from that.
Patience is most probably one of the biggest ones, because I do realise I'm quite an impatient person. I have an idea and I like to go ahead with that idea, and sometimes not build up the solid foundations. And I think listening to other people and their experience has actually given me that. It's also given me the opportunity as well to part of the action learning groups that we have in Wales, where there's 4 of us in my cohort, and we meet up on a regular basis and we discuss what we're doing at the particular time and the issues that we're going through. And it's always a bit like a peer reflection again, that we can see where we are.
I think one of the main things that I've learned is to be more confident and to speak out, and to develop some of the areas that we as a team wanted to take forward. But for myself personally, it's certainly given me a lot of confidence to think that I can stand up in front of people where I'm not normally involved in their sphere, particularly commissioners, and take forward ideas and go to them and say what we would consider to be important locally about diabetes. I think the staff at Ashridge, the things that we've learnt on the course, the action learning sets that we've done, being involved with people who actually work in very close geographical proximity to me, but because we're in different organisations we never get to meet up. And I think listening that we all sort of listening to each other and appreciating that we all have the same challenges, we're all in the same position, we're all being asked to make changes in diabetes with very little if no extra funding, and how we potentially could work together across boundaries to develop aspects of diabetes care that we can share with, certainly with other CCGs and with other trusts.